maybe it was a stroke, that I was hit by a stroke, maybe a cane, right? But the medical name for it is actually cerebrovascular accident, or abbreviated as CVA. So that's the medical term for stroke. But we will not be using that so much in this discussion, because we want to be as simple as possible so that somebody who is not of the medical background will understand. So cerebro basically comes from cerebrum, which is the biggest part of the brain. And then vascular is from a blood vessel. So any accident in the blood vessels in the brain can result in a CVA, and we call that stroke. So we'll explain what it is, the risk factors, signs and symptoms, how it is diagnosed, any complications, treatment, and then how we can prevent stroke. Maybe for a minute, if 1 or 2 people can put up their hands, what do you see in this slide? Anybody wants to try? What do you see in this slide? 1 or 2 people to say what they see, just to have an understanding of whether some people know what is here or not. Anybody wants to try? So Minyo, you are saying you are seeing the human brain. Okay. Wani Patrick, what do you see? You can unmute and comment. Wani Patrick, you have put up your hand.
I'm able to see a brain, human brain matter.
Okay, human brain matter. Okay. Somebody had unmuted and wanted to say something. What do you see on this slide?
Yeah,
James.
actually, this is a human brain. Yeah.
Okay, so basically all of you are right. These are images of the human brain, but specifically it is a test called the computed tomography, or CT. And for ease of pronunciation, we just call it CT. So this is a CT scan of the brain. Different directions, different levels of the brain have been taken, slices of it, and then the images are put together. And somebody who knows how to interpret CT scans should be able to look at these critically and be able to identify if there is any problem or where. This is not for this session as such, but just to make you see and understand, or in the future, if you see a film that looks like this, you will be able to understand what it is. Again, in this session, I'm not taking you into an anatomy class, but I think having a very basic understanding of what is in the head in terms of the brain might help you better understand when you look at a stroke patient, and then you begin to imagine that, oh, I think something like this. And again, it's not for making you to diagnose these things. So if in my seated position now, if you stood behind me and you looked at the top of my head, you would be seeing this part of the brain, which is the cerebrum that I talked about, is the largest part of the brain, and it is usually divided into two. So the left side is what we call the left hemisphere, and the right side is the right hemisphere. The importance of understanding this is that nerves that come from the left side of the cerebrum or the left hemisphere somewhere tend to cross over to the right side of the body. And so they will control function of my right side of the body. And the opposite is true for nerves from the right side of the cerebrum or the right hemisphere cross to the left. So that is a little bit of something you might want to know, so that if there is any accident that happens on the left side of the brain or the left hemisphere, then the outcome or the changes in body function are usually seen on the right side, and the reverse is true. And then if you looked at my side, okay, you are standing by my side and you're looking at me here, you see behind my head and then in front of my head, this is what you would look at. So behind is another part of the brain called cerebellum. The cerebellum mostly is about balancing yourself as you walk. But the cerebrum is the biggest part of the brain. And that's just the little understanding I want you people to get from here. So what is stroke? It is a clinical syndrome. A syndrome usually is a combination of many things, signs and symptoms of different things coming all together, and we call it a syndrome. This is a clinical syndrome of rapid onset. Often, most times rather, it is rapid. So the onset of the symptoms or the signs is rapid. And those are syndromes that come from where? From the cerebrum or the cerebral function being reduced. So there's a deficit, there's a gap in the way the cerebrum now functions. So it results in a certain sign or symptom that you are able to see. And for you to qualify it as a stroke, this one must last more than 24 hours. So something started maybe this morning, and then you have already started identifying abnormalities in the way I do my things today, and it has persisted beyond tomorrow morning, that you could call it a stroke. Usually it will lead to either death, sudden death with no apparent cause, but sometimes people survive a stroke event, okay? And as you have heart attack, this one sometimes is also termed as brain attack. So there's an accident in the vessels in the brain, blood vessels in the brain, and then you are seeing the outside manifestation of it in terms of the way the person functions, okay? Now, if the symptoms last less than 24 hours, then the term for it is called TIA, transient ischemic attack. This one is a form of stroke, yes, but it's mild. So the symptoms are not lasting 24 hours. So a few hours and the person goes back to the normal function. But it is always something to take note of, because it can be trying to alert you that something worse might happen, okay? So as I said, stroke occurs due to blood supply problems in the brain. And what are these problems? Mainly two. One is blockage of the blood vessel. And if it is the blood vessel that is blocked, that means the part beyond the blockage, part of the brain beyond the blockage, will not receive blood supply. If that happens, that part of the brain begins to die off, because without blood, there is no food, no energy, no oxygen to that part of the brain. It begins to die off. Now, the type of stroke that results from blockage of a vessel is what we call ischemic stroke. And it is the commonest form. About 85% of the cases of stroke are resulting from blockage of a vessel. Things that can block that vessel could be a blood clot that dislodged from somewhere, and then it kept on moving, circulating, and then it reaches where it can no longer pass, and then it just ends there. So cutting off blood supply. It could be also fat tissue, especially for the obese and those with the high amounts of fats in the body. So those are other things that could block blood vessels. Sometimes even air, air in blood is not good. Air in the blood vessel is not good. It can also circulate like that because there's no way for it to come out. It can circulate like that and reaches where it can no longer pass, stops there, and it will not burst. So it blocks supply. So this is ischemic, blockage of blood vessel. Then the part beyond the blockage of the brain, part of the brain beyond the blockage, dies off. The second problem with the blood supply is bursting of the blood vessels, or we call it vessel rupture. And if that happens, that means bleeding will now happen into the brain tissue. And that we call it hemorrhagic stroke, which is about 15% of the cases of stroke. So it is hemorrhagic. And again, as the bleeding occurs, that means blood is no longer being supplied to reach every little cell of the brain tissue, and those cells will also die off. Another problem is that as the bleeding continues, it will compress other blood vessels that supply some other parts of the body, of the brain. And in that case also, those parts of the brain whose blood now is compressed and blocked off will also die. So that is the hemorrhagic type of stroke that we talked about. So basically, you are talking of ischemic stroke, which is the commonest due to blockage. There is hemorrhagic, which is due to rupture of the blood vessels. And then there's the TIA, which is something that has happened. It might be a blockage or a small rupture, but it has not persisted beyond 24 hours. So then it resolves, and then it becomes TIA. So a stroke is definitely a medical emergency, treatment must be sought as soon as fast as possible. And the time here really is of the essence. If somebody is able to identify, as we shall see in the next few slides, how to identify a stroke case, even at home, immediately somebody should be able to rush this person to the nearest possible facility, and then the necessary support should be given, at least within the first 1 hour or so. Okay, it's a medical emergency, especially if the patient has not died immediately. But as we said, they could just die at once. Yesterday, we talked about the World Diabetes Day, World Hypertension Day. Stroke also has its own day, which is the 29th of October. So if you think you can create something within your locality and tell people about stroke and how they could prevent it and so on, it might be a very good day to do something like that. And in the same way, if you have or you know somebody who is suffering from stroke, the aftermath of a stroke, you could also make them feel happy on that day and say, you know, this is a day to remember you people. So just to add a picture into your mind, the ischemic stroke, as I said, is due to a blockage. So you see here, this very nice blood vessel, red in color, full of blood, but reaching here, nothing. So there's a blockage here. It could be a clot. It could be even an air embolus or anything, just cuts off supply. And you see the part of the brain that is supplied by this blood vessel begins to die off. Okay, so this is ischemic stroke and is the most common, as I said. Then the opposite here is the hemorrhagic, which is due to rupture of a blood vessel. Things that can cause rupture of blood vessels, of course, will include high blood pressure or even a fall or a hit. If you're hit in the head, somehow you fell down or something, it could cause blood vessel rupture and bleeding into the brain. So that can also be hemorrhagic stroke. And then, of course, the TIA that I talked about, let's always consider it a warning sign that something else and something worse might actually happen beyond the 24 hours, okay? Just to put a picture in your mind. In terms of how prevalent this condition of stroke is, annually about 15 million people worldwide are said to suffer a stroke, okay? And of these, about 5 million die and another 5 million are left with the permanent disability, okay? And the problem with the disability here is that the burden is on the family and the community to take care of these people. I believe some of you could have come across stroke patients and you know how disabled they are really to the extent they cannot do basic daily things that a normal person should do, even when they have been doing them, like bathing, some of them even not able to eat or sit up and so on. So that's how bad it is in terms of the burden. There's a fact sheet by Global Stroke released in 2022 that revealed that the lifetime risk of developing a stroke has actually increased by 50% over the last 17 years. So now 1 in 4 people will be estimated to have a stroke in their lifetime. So we are 17 people in this call now. About 4 of us in our lifetime will suffer a stroke in our lifetime. That's what the fact sheet says. Okay, so stroke is uncommon in people under 40 years, but if it does happen, the main cause is usually high blood pressure. Okay, however, it can also occur in about 8% of children, especially those with a disease called sickle cell. The problem with the sickle cellers is that their red blood cells, the shape, as the name suggests, is like that of a sickle. For those who know the garden tool called sickle. So the shape of the red blood cell is that kind of a crescent shape, like a moon that has just appeared. So that sickle shape tends to cause problems with the movement of the red blood cell, and it can reach somewhere and stop, like it can no longer circulate, so it can cause a blockage. So it's about 8% of children with stroke. Most of them are those with the sickle cell disease. For every 10 people who die of stroke, 4, so that's 40%, could have been saved if their blood pressure had been regulated. Just imagine how big a problem high blood pressure is. And we talked about this yesterday when it comes to stroke, okay? So for every 10 people who die, 4 could have been saved if their blood pressure was regulated. The problem, as I said yesterday, is blood pressure, silent until when it begins to show up, damage is already done, so that's a problem. And among those aged under 65, about 2 out of 5 of them who die from stroke are linked to smoking. So 25% of those who die of stroke before 65 years, actually 20%, 2 out of 5, 20% of them are linked to smoking. And I think I talked about this also yesterday, smoking being a very big risk factor for even diabetes and high blood pressure or hypertension. In Africa, data published within the past decade shows that stroke has an annual incidence rate of about 316 per 100,000. So if in the town you are in now, if there are 100,000 people counted, about 316 of them could develop stroke or could actually be having stroke. That is in Africa. Moreover, many Africans have a stroke within the 4th to the 6th decades of their lives. So the most common age to get a stroke in Africa is between 40 and 60, okay? Of course, serious implications for the individual, family, and society, as I already earlier mentioned. Patients, providers, payers, and then policymakers and the public should be in a concerted effort with the scientists and funders to maintain prospective vigilance of the continental stroke burden. This is more of a public health recommendation here that we should be very vigilant of the burden of stroke and therefore try to influence the determinants of stroke as early as possible by modifying the risks. Okay, and that brings me to the risk factors for stroke. Number one, even though they have not numbered them, but from the left top row and going across, you see smoking. Big problem. As I said, those who die below 65 of stroke, 2 out of 5 of them have are attributed to smoking. Okay, those cases come from mostly smoking cigarettes. And then you have some medications. Some medications can cause blood to become too thin, and then it can cause easy bleeding, okay, around the brains. High blood pressure, I cannot overemphasize this because it has already appeared in the last few slides. Uncontrolled or excess alcohol always is a problem. One risk through being an alcoholic is falling anyhow and getting damage to the head or injuries to the head, so excessive alcohol use is another risk. Heart disease, especially diseases to do with the heart functioning, the rate of beating of the heart. Medically, we call them arrhythmias, diseases that cause irregular or abnormal heart beating can actually put the brain at risk of an accident and therefore stroke. High cholesterol, these are lipids or fats in the blood, particularly the type called cholesterol. If it is high in blood, the problem is it begins to be deposited at the edges, or rather the lining of the walls of the blood vessels, and therefore over time it will cause blockage of that vessel. Okay, so it can cause the ischemic type. Stress, this stress may just be mental stress or even from trauma to the head. As I said, the problem here in mental stress is the blood pressure always goes up if somebody is stressed to try to deal with the situation, right? So that can be another risk for especially hemorrhagic, where it will cause rupture of blood vessel. Diabetes and obesity, we talked about this quite a lot yesterday, and they also increase the risks for stroke. And these are mostly, you can think of them as modifiable things. Even the heart diseases can be modified by treatment. High blood pressure, diabetes can be modified by treatment. And most strokes are caused by modifiable risk factors, actually, up to about 80% of the cases. So you see that maybe 20% of the cases come from non-modifiable risks, like things like old age, things like genetics. The problem in old age is usually blood vessels get get stiffer and stiffer, harder and harder, not very easy to bend around. So it can cause high blood pressure itself, and then further bringing the risk of stroke. Like genetics, as I mentioned yesterday, some people may have higher predilection for stroke or higher risks for stroke, just because naturally from their family there has been that gene for a risk of stroke. So those are the risk factors for stroke. And of particular interest, I picked out smoking here and blood pressure, because smoking damages blood vessels. It causes inflammation. If a blood vessel is inflamed, it swells, it tries to, respond to the inflammation, and in that process can cause blockage of the blood vessel through a formation of something called a plaque. Okay, so that plaque actually can dislodge. Sometimes it can dislodge from here and circulate around, goes into the brain and then blocks a blood vessel, or into the heart and blocks a blood vessel that supplies the heart with the blood and cause a heart attack. Okay, of course, blood pressure, smoking also can harden the arteries, as we said, and raising blood pressure up. So that's how smoking is really quite dangerous in these two things, high blood pressure and stroke. So if somebody has had a stroke, how would you identify? I like this picture here. It says spot a stroke. You learn the warning signs. And by the way, these are warning signs that do not need you to be medically trained. And you can actually, if you live with somebody and you know them very well, you know their face very well, you know how they act every morning they wake up, what are the things they first do, and so on, you can easily identify abnormalities in their daily routines, and it can actually be the first thing you need to do, and you start to call for emergency or call for help. So it is abbreviated here that be fast. Be fast. And indeed, you need to be fast in your actions when you see these things. B stands for balance, loss of balance. They might have headache or dizziness, but it's loss of balance. So somebody it's a very common thing actually in the elderly. You hear a story, somebody has been brought to the facility and the person who brought is narrating, oh, we woke up well and grandpa or grandma was just okay. We brushed teeth, took tea, and then he or she got up, was trying to walk to the bathroom, and then just fell. Okay, so that's loss of balance, the most common thing there. And you begin to wonder why this collapse when somebody is not even moving with a stick. So loss of balance is something you can always look out for. Was it the issue? Somebody had to fall down, or what happened? You can look at the eyes, or they can speak to you and tell you they are not seeing well, or the person starts complaining of not seeing well. It might be something you want to be worried about. So blurry vision, okay, and then the face, very important, the face. So this first is actually very important for you to remember. F stands for the face. What do you want to look at the face? Is it like one-sided kind of face? You can try to talk to the person and try to make them smile. A person who normally smiles and both sides of the cheeks are retracting normally, well, they try to smile and it will be like maybe like one side is, they are trying to smile, but it's bending one side. That's the face. You could even look at the way the eyes are. Maybe one side of the eye is like closing or falling down in terms of the way they're looking at you. So the face is usually a very, very important part of the body to try to look out for signs of stroke. The arms and even the legs, you can tell they can become paralyzed. They will not be able to lift their arm or even greet you if you try to greet, assuming the paralysis on the left side, on the right side. So arms and the legs are other parts of the body you want to quickly look at if you are suspecting issues of stroke. The S stands for speech. Most of the stroke victims will have altered speech because of the damage in the brain affecting part of the brain that controls the speaking. So I speak as I speak, and then I have had an accident in the brain, and now I'm assuming I can't say something and you can't understand what I'm trying to say, right? These are some of the things you will be able to find out if somebody has had a stroke. So speech will be with the difficulty, words are not coming out clearly. They might not even open their mouth very well as you used to know they do. And lastly, T is time. Immediately you see some of these FAS signs. Time is of the essence. This is the time to call emergency. This is the time to call rapture or whatever means, rush this person to the nearest facility that can be of help in that situation. Right, so these signs and symptoms can develop over time, but like I said earlier, most times they are sudden onset. So somebody waking up well, as I said, and then they just develop these things all of a sudden, okay? The type of symptoms depends on the type of stroke and the area of the brain that is affected. And that's why I had to begin by showing you some basic parts of the brain for you to understand. Like I said, if the paralysis is on the right side, most likely the problem happened on the left side of the brain, what is called the left hemisphere. So that's how you tell that, oh, the stroke is somewhere there. But now the type of stroke, whether it is due to blockage, ischemic, or due to rupture of blood vessel, which is hemorrhagic, will now be identifiable when the CT scan of the brain is done. So again, the type of symptoms might depend on that. So if it is maybe something that affects my speaking, somebody who understands the location of the centers in the brain where speech is controlled will know that, oh, I think the stroke has affected this part of the brain. Okay, so that's how the symptoms and signs are related to identifying the location of the accident. So how long the symptoms last and how severe they are also varies among people. Severity, especially the worst severity you think of is death immediately. And then others get paralysis, they suffer the side effects or the aftermath even for the rest of their life. Others, especially in the TIA type, will regain full function. So how long the symptoms last and the severity really varies between people. And these are some of the signs and symptoms: sudden weakness, paralysis, or numbness of the face, arms, or legs, confusion, somebody is acting very confused all of a sudden, trouble speaking or understanding speech, trouble seeing in one or both eyes, problems breathing. This is a bad one because then somebody might easily die because of lack of oxygen. They may not be able to walk, they have lost balance, they cannot coordinate their movements, okay? They may even lose consciousness. Some of them, because maybe of where it is, the location of the accident, can lose control. They can lose control of urine and feces, and we call that one incontinence. So if they become incontinent, and then they can just pee on themselves, they can poo on themselves. Sudden and severe headache, these are some of the signs and symptoms that either the patient will tell you or you will identify after the stroke has happened. How do we diagnose a stroke? In the health facility, the health personnel will ask for history. Important is smoking history. Does this person smoke? Has he been or she been smoking? Did this person experience a similar kind of situation before in the case of a TIA? Or is it something sudden or something has been developing gradually over time? What about in the family? Did somebody ever suffer a stroke? Does this patient have chronic illnesses like diabetes, like hypertension? Okay, or are they obese? You can see in the body and things like that. And then, of course, they fast. What is on the face? How about the arms and the legs? How is the speech of the patient? And then, of course, the time when these things happened until now that this person is at the health facility. All these can make part of the history that can guide the clinician to make a diagnosis of stroke. There could be other things they can ask you as well. Of course, immediately after taking history is to examine the patient. Things like heart rate. Is it regular? Is it irregular? You are thinking of heart issues or diseases. What about the blood pressure? And this is most commonly when people are found with a high blood pressure that is maybe 200 over maybe 100 something millimeters of mercury. Then you'll be like, yes, this is the problem. It could be hemorrhagic. A blood vessel could have ruptured. Body weight, as I said, you might want to relate it. A head-to-toe examination usually is done, especially on the face. You are looking at deviations. The lips are deviated to one side, things like that, mostly due to weakening of muscle function on the side that is deviating to. So the other side of the muscle of the face may not be deviated. Speech, somebody not speaking well, or there may be actually no speech at all. Okay, and then you try to pinch them or prick them, they don't feel it, so they have lost sensation, and then they are not able to lift their arm. This is loss of motor function of the arm or the legs. So these are physical examination tests that the clinician can carry out and compare with the history and say, okay, this is a stroke. Okay, laboratory tests can be carried out, especially to look for underlying cause or condition, such as blood sugar, if you are suspecting diabetes, maybe lipids. These are quite not commonly done, and they are quite expensive tests for the lipids especially. It can be done if especially the rest of the other things are not giving an answer, okay? An ECG can be done. You don't need to worry about it, but it's just a test that tells us the functioning of the heart. Is it normally beating and moving well and so on? So it's called an ECG. It can tell us abnormalities with the heart beating, which, as we said, could be a risk for a stroke. Of urgency is a CT scan of the brain. This has to really be done as early as possible, possibly within 4 to 6 hours of the event, of the accident, if it is available, okay? Because it will help us in three things. First, to identify, the type of the stroke, which is either ischemic or hemorrhagic. And then from there, it will also help us to now locate where it has happened in the brain. And lastly, with what treatment can we manage this person? Because if it is a blockage, ischemic, which is the most common, we said 85% of the cases, then you want to put something that can break down the clot, a medication that can break down the clot, and hopefully it is given in time for that clot to be dissolved and blood flow returns, so that the part of the brain that started dying away could regain some bit of function over time. So that is the importance of the CT scan, to differentiate, is it blockage or is it rupture? If it is a rupture, you want to minimize blood pressure and blood flow to the brain so that the bleeding reduces. And maybe over time, the blood vessel can heal back and then no more bleeding and so on. So that's the importance of the CT scan of the brain, and must be done as early as possible if it is available. Others like the MRI, don't worry about them for now. What is important is somebody with a stroke. If you are able to identify those signs and symptoms, think CT scan of the brain. And once we identify that, what do we do? How do we manage? Emergency, I will not overemphasize this. The golden hour rule must apply. As much as possible within that 1 hour, something has to be done, because when brain cells die, they do not often regenerate. Okay, so it becomes a problem at all, and you are leading somebody into a complicated life that they will live because of permanent disabilities. So in this golden 1 hour, for example, if somebody has collapsed, has fallen down, one important thing is to try to protect the airway, make sure that it's not closed, because they need to keep breathing as much as they can as they are being rushed to the hospital. And of course, assuming they reach the hospital and a brain CT scan is done and they are able to identify the cause, like I said, if it is the ischemic, which is due to blockage, you want to break down the blockage, and most commonly people are given aspirin, which tends to dissolve clots. Okay, and then there are others like the TPA, which also works in a similar way to break down the clot, and then vessel repair surgically may be needed, so that clotted part may be opened and then the clot is removed and is replaced, so that blood flow is regained. So those are now two complex things. Too much complex, I mean the surgery may not be a common thing, but most times if it is identified as an ischemic stroke, these medications that break the clots are given. And then, like I said, in hemorrhagic, drugs that reduce blood pressure. So the importance here is that the bleeding is reduced, the chances of developing seizures also is minimized, and then the chance of further compression of other blood vessels, which will also cause more damage, is also minimized. That's in the hemorrhagic. And if a patient suffers rupture of blood vessel when they are already on blood thinners like aspirin, then these ones have to be stopped. And then other anti-blood thinner medications are given to counter that effect of the blood thinners, so that the blood does not become too thin, a little bit thicker, and the bleeding may reduce. Okay, so if it was just simply a TIA, transient ischemic attack, this patient might just be observed as this condition resolves within 24 hours, but then this person needs to be watched out carefully, keenly, for a full-blown stroke event. Okay, because we said this is more of a warning sign. And usually people who suffer TIA should actually be put on preventive medications, depending on what risk factor they have. All right. If stroke is not treated, for example, from the TIA stage, if somebody is lucky to start with a TIA, they need to be on prevention medication. But if they get a full stroke and they are not well managed very well, for example, these are some complications that can occur. If it is affecting nerves that supply airway and the digestive system, they can have, because these two systems, the airway system and the digestive, have a junction somewhere down the neck, and things that go into the digestive system are keenly controlled from going to the airway, and the reverse is true. So some people can suffer what we call aspiration pneumonia. They try to pull out what was from the stomach, and then it goes into the airway due to that loss of control of these two systems. Due to also injury to bladder, nerves, and so on, loss of control of urine, they can get infection in the urinary tract. They can get something called deep vein thrombosis. Don't worry about it. The worst thing is getting some embolus, like maybe a blood clot or something going into the lungs, and that one tends to kill immediately. People who become bedridden due to a stroke over time develop what we call pressure ulcers. Usually they are at the bony parts, at the elbows, at the shoulders, at the knees, at the hips. So bony parts where you can easily feel a bone. When they become bedridden and they are lying in bed most of the time, they develop pressure ulcers. They can become malnourished. Most of them are not able to feed themselves and so on. Shoulder pain, other kind of pain. The worst thing is that some of them can actually become depressed. And it's a normal thing, because if they do not get enough psychosocial support from the family, they begin to curse themselves. You know, they are this person who used to do their own things, bathe themselves and so on, but they need to now call for people. Oh, I want to pee. They have to help you out. It can cause depression, and that is not a good thing. Many of them will have issues of falling down because they are not able to balance themselves or control their movements very well. So these are all complications that can come from a stroke event. The other, in terms of the brain function, can be recurrence of the stroke, which is not a good thing. And epilepsy or epileptic seizures can also come. In terms of recovery of the extremities, some of them can develop contractures. So the arm is no longer easy to stretch out because of that constant, constant folding it back. So we call that contractures. Others develop memory loss, vision, and hearing impairments. All these depend on what part of the brain was the accident, and then it manifests on the part of the body that is controlled by that part of the brain. Okay, so quite a lot of complications can come from a stroke. Of course, death is one very bad thing, and we cannot rate it as a complication because somebody has died of the condition. For a survivor of stroke, they need to undergo rehabilitation for many things, beginning with the speech, especially those whose speech is affected. They need to be helped to recover how to pronounce words, how to produce them, how to understand. So it will be called a speech therapy. Others need physical therapy or physiotherapy, which will just help them to relearn body movements, how to lift your leg, how to lift your arm, and then how to coordinate it to pick up something and maybe put it somewhere. So all that is physical therapy. That is important. And during this also, they need to be regularly turned in bed to avoid the pressure sores or the pressure ulcers that I just described moments ago. Occupational therapy will also be helpful to improve their ability to carry out routine daily activities like eating, dressing themselves up, bathing, or visiting the toilet and stuff like that. I think this is most important, psychosocial support. All these things you can do, but if you do them with a moody face, with the jeering every now and then, and so on, you actually will not help them recover any of these functions that you are trying to support them to recover. So psychosocial support is important. Reassure them, yes, the situation is there, but you are there for them. You are willing to support them through. You can do this as maybe a group of people who have suffered stroke, visiting maybe somebody who has recently been hit by a stroke, and then they encourage them, they motivate them to keep fighting it up. Family members are very important in this case, actually, because that is where the psychosocial support begins. The speed with which you respond to their calls. Oh, I feel like going to urinate. If you take 5 minutes, 10 minutes, and so on, maybe you find they have peed on themselves. I mean, those are the small things that affect their psychology, and then they will actually slide into depression over time. So psychosocial support for any stroke survivor is very important. How can we prevent stroke? Modifying the risk factors that are modifiable. If it is about weight and obesity, we know what to do. Yesterday, we talked about the diabetic diet. We talked about the healthy lifestyles and the different things we mentioned there. Here again, we are repeating some of them. Let's have a healthy diet, keep a healthy weight, which we mentioned yesterday, between 18.5 and 24.9 BMI. And then if you smoke, actually stop it. If you have never tried it, don't even try, because we have seen here the high risk of smoke. Smoke poses to issues of stroke. And then moderating or actually stopping alcohol intake is very important. Managing blood pressure and blood sugars, that is to say hypertension and diabetes, very well, so that they are all controlled and the risks are reduced for stroke. Preventive medications, especially if they have had TIA, I mentioned this. Checking blood lipids or fats, such as cholesterol, because then if they are known to be high and somebody has not yet had a stroke, they will be given medications also that reduce the level of cholesterol. Okay, any heart disease needs to be treated promptly and appropriately, because we have seen that heart disease is a risk factor for stroke itself. To conclude, we said stroke is mainly of two types. There's the type which comes from blockage of a blood vessel, and we call it ischemic stroke. And then another that comes from rupture of a blood vessel, we call it hemorrhagic stroke. The ischemic is the most common. However, we also have another type which lasts less than 24 hours. We call it transient ischemic attack, and it should be treated as a warning sign for future stroke. Smoking, obesity, hypertension, diabetes are major risk factors for a stroke. So whoever is with or practicing any of these should try to modify these things as early as possible to minimize the risk of stroke. But we also said other risks include stress, genetic predisposition, and also even old age itself. Okay, stroke is an emergency. let's be able to spot it as early as possible. We can apply the FAST, okay, which is looking at the face for any changes, looking at the arms and the legs for any changes and inability to use them, listening to the speech of the patient and identifying abnormalities, and then acting as fast as possible within a specific time, okay? CT scan, I mentioned it as the mainstay for diagnosis because it also helps us with the classification and then determining the form of treatment that is needed. As much as possible, we should get a CT scan of the brain for any patient with a stroke as soon as possible. Survivors of stroke will need other form of care, such as physiotherapy, speech therapy, occupational therapy, and so on. But of course, I stated that the most important should be psychosocial support that we have to offer these people, because then they will be able to recover mentally, and then the other physical recoveries will come over time. I would like to stop there. Bida, if you are in the call, let me let it up to you to guide if there are any questions or comments.
Okay, thank you so much for the session. This session on stroke, very, very important. My father died of stroke actually. In 2014, he collapsed at home when he was alone, and then he couldn't be rushed to the hospital early enough. So actually, before they reached the hospital, he had already passed on. So that is how serious this disease can be, and it is very important that people should use information from such health awareness sessions to be able to engage even people within their network further and share some of the best practices as you have mentioned. Once again, thank you so much for your time, for sharing your skills, for sharing the knowledge as well as experience. I believe that this will go a long way in helping all of us make proper health choices and also advise us accordingly. So when I look at the comments in the chat box, there are questions as well as there are some comments. So I would like to take a look at the first. So the first is a question is saying, is CT scan machine available in South Sudan, particularly in the states and hospitals? And then somebody's asking, somebody made a comment that for him, he has never smoked since only some of the smokers are his friends, and sometimes they stay near him. And then somebody's talking about attendance. We'll share the attendance shortly. So, okay, sorry about the network. And somebody say most people in Europe smoke. Also in Congo, both men and women smoke a lot. He doesn't know why. Yeah, so I think the major question there is the one for the CT scan machine. Is CT scan machine available in South Africa, United States? That is the question. Meanwhile, I would excuse you, Leju, maybe to go. You can go grab a glass of water and take a 5 minutes break. And then, Wani Patrick, would you like to make some comments? You're welcome.
Yes, thank you so much, moderator. As you have stated, my name is Wani Patrick, also a medical practitioner here in Uganda. I would like to thank my colleague, Dr. Leju, for the time that he has given to us. Mine will be a compliment as trying to also add on the one of the cause for the stroke being a vascular causes. Vascular, I mean origin is the blood vessels, and the rising cases nowadays that we are seeing is HIV infection, because it has its long time effect in damaging the blood vessels. So especially the one in the brain causes vasculitis, and that results later into one of the type.
Leader, I am back. The place is quiet. Edward, go ahead.
Okay, great. Edward, you can proceed.
Yes, good afternoon, colleagues. Good afternoon, everyone. It's me, Edward, a medical practitioner specialized in the hospital medical service within the country. I've been following up all these health education services, especially provided by Excellence Foundation South Sudan. Is a good job to everyone. It's a good job to all the founders of these services. Mine is not a question, it's just an appreciation for this initiative. As a proactive, is a good initiative, and wish all of us to take lift up onto this. And in relation to today's session, especially yesterday and today, I've been closely following up on this. Indeed, cardiovascular disease is globally recognized or categorized as the highest killer of all among all health-related conditions. I would like to all of us to keep on in relation to this initiative as an experience. I'd like to bring to everyone's attention. It's a couple of cardio-related conditions that I personally encounter in our setting. Take an example where I am. I spearhead the United Nations Management Service services. And in our settings, we would deal more of out of hospital-related services. Take an example of how we counteract or we eradicate over 20 years of mine-action-related services or services in the country. In relation to this, we come up, of course, the United Nations take a lead in eradicating all these services based on medical initiative we have in the country. In relation to this, I'm trying to narrow this out with our health setting. A couple of years, we had life happenings, life conditions related to cardiovascular disease that happens in our let me say in our offices. There happens between 2014 up to today, we happen to lose our loved ones, at least 2 cases. One example was a good friend of ours who was an HR manager, and on that very day, he was a lead in all activity that we do, to extent where was we as a management organizations, we had the initiative how we can support ourselves. So that week was a lead of providing services of logistics, where he drive all of our staff safely to home, and he went and parked off this UN vehicle to one of our UN agents' compounds within Juba. Then he he safely went home by walking from where he parked the vehicle, and upon arrival home, then he found her mother not feeling well. So within Juba, let's say from Munuki, we took the mother to EB Medical Service, and the mother is unwell. Of course, during that medical intervention of the mother, then he deteriorated from that moment. So upon all these shackles or services that we provided to the mother and the EB, everything turns to him. Then immediately, the practitioner of EB diagnosed that this is a cardio-related disorder. Then, of course, he say, oh, okay, for us, we had our medical services, which is United Nations Management Service and UNMES Medical Service. Then he immediately let this people call me before I intervene or reach to EB Medical Service. The EB facility narrated or come out with an advanced medical facility. He refers to Aspen Medical Service, close to Crown Hotel, before they seek to their 1-2 current existing facilities. So before he arrived to current Aspen or Aspen Medical International, things happens to go out of hand. And as a medical practitioner, we know our cardiovascular system will not tolerate hypoxia of more than 2 or 3 minutes. So in this regard, I would like to thank Excellence Foundations and the initiative coming up with this initiative. Is absolutely very good initiative of health education among ourselves as a health practitioner, also to our lay mind persons, such that we are aware. And the Jew and our colleagues, I would like to request you people, based on I think we have gone through malaria, we have gone through hypertension, we have gone through today stroke-related conditions or cardiovascular disease. I would like to ask to prioritize based on South Sudan surveillance. What conditions we suffer most, so that we can hit on. I would like to stress this based on my level of let me say qualifications. Pre-hospital services is at a very, very, very low in our country, to be honest. And in this regard, if we can have sometimes with you guys for a kind of face-to-face interactions, such that in the near future, I think it's good for us also to come into face-to-face to organize for a kind of interaction, especially for provisions of a first aid related face-to-face interaction with the colleagues who are interested in this. In this regard, we have got a number of organizations that I supervise, and I do quality assurance to them in relation to management activities, in relation to pre-hospital medical services in the country. So I guess it will be beneficial to all of us, and this pre-hospital medical services that provides to our medical practitioners in countries, because what happens here is from many years, we have been.
It might be down there.
Robert Lubajo, could you mute? Robert Lubajo, kindly mute. Thank you.
Yes, yes. You
Edward,
guys
could
listen.
you wind up? Yes, we can hear you.
Yes.
Could you wind up?
Yes.
Thank you.
And this pre-hospital medical service has gone through a series of medical practitioners, which I cannot mention as of now. But tomorrow, I guess, if we meet face-to-face interactions, it will be beneficial. Personally, when I come up to this initiative of Excellence Foundation, is very interesting, not only on not in the field of pre-hospital, but also as lines with the public health services for South Sudan in general. So thanks, everyone. Thanks, colleagues, you, Ida, and Dr. Modi.
Thank you very much.
Okay, great. Yeah, thank you so much, Edward. But maybe I because for me, I'm not somebody of a medical background. But what is a pre-hospital service?
Robert, can you please mute Robert Lubajo?
Yes, Leju and everyone, Bida, Leju, can you clarify that pre-hospital means medical interventions that are provided out of hospital?
Okay.
So
it's just more of
a kind of first aid. Take an example, somebody has collapsed of cardiovascular disease in Budele, then a team of medical pre-hospital specialists who are trained, how to provide pre-hospital can intervene where this person has collapsed and brought him or her to advanced medical facility.
Okay, yeah, thank you so much. And also I see you talked about possibility of a meeting. Maybe you can just email us your availability through this email in the chat box, and then you can catch up with Leju sometime this week. So our email is here. You can just send us like some of the details, like office location and time, and then you can meet to discuss with Leju, and then you can then get back to us. Thank you so much, Edward, and
yes,
we appreciate your time here.
Yeah, interesting. I'll link up with Leju, and we'll keep in touch.
Okay, great. Thank you so much.
Yes, Mr. Edward, you can as well copy me on my email here in the chat box. Thank you.
Okay, great.
Thanks, Leju. I'll do that.
Okay, great. Thank you so much. Any other additional comments or questions that have not been addressed?
In the chat box, there was the question about CT scan services. I have replied to the person who asked, but I think it's also good to say it here verbally. I do not think our state hospitals are that well equipped to that extent. I'm not very sure, but I quite believe they are not there. Those services are not there because even Juba Teaching Hospital, which is our national referral hospital, does not have a CT scan by itself. So it's hard to imagine that some state hospital might have. However, I also provided that in Juba Medical Complex, and I know Egyptian Clinic, I think those are two facilities that I know have CT scan services. The cost, I am not sure for now, but I've seen people get CT scan services from those facilities. So if the need is within Juba, I think somebody can rush in there to those facilities. Over.
Okay, yeah. And then I also see a couple of questions that you've been able to answer in the chat box. If there are no additional comments, I think we would excuse you, Dr. Leju, and we would wish everyone the very best of their Sunday afternoons. Do take very, very good care of yourselves, and we hope to meet again after 2 weeks.